For more than a year and a half, we've dutifully queued to get up close and personal with a swab.
That will be supplemented with the access to home testing for Australians.
But as vaccination rates rise and the pressure to suppress COVID-19 wanes, at least in some states and territories, rapid tests in the comfort of your own home are close to getting the tick of approval.
Several stars will align around about the 1st of November.
There are already more than 30 rapid tests approved for use in Australia, but only under the supervision of a nurse or doctor.
Even though the little cartridge will be the same, everything else will be quite different in a home test. And we're working with those companies to transform those tests.
And while getting the green light from the national regulator is the first step, the next is getting states and territories to agree to use at-home swabs within their borders.
It will be an important additional tool in the public health response right across the country.
What we would want to be satisfied, though, is that the testing is accurate.
Aiming towards national consistency is our
It's been hard to
primary
reach,
purpose.
hasn't it? It's been pretty hard to reach in any area.
Overseas at-home tests have been a feature for some time.
Australia has fallen behind once again when it comes to rapid antigen tests.
But the regulator argues the COVID-19 situation in Australia is vastly different.
When a lot of these home tests were developed for Europe and the US and North America, we didn't have much Delta around. And so absolutely critical is to check that they perform well with Delta.
The release of the tests in November coincides with some states and territories further easing restrictions as vaccination targets are reached. The pace of the rollout now hitting 2 million doses a week after early delays. The Prime Minister's previously suggested changing advice from the National Immunisation Advisory Group was partly to blame for the slow initial rollout, prompting this response from the group's co-chair before a Senate inquiry today.
I'm clearly not a politician. I'm a clinician who works as a technical expert for the Commonwealth Government. I was shocked and surprised.
Atagi insisting it's always been up to the government to decide the path out of the pandemic. Matthew Doran, ABC News, Canberra.